Okay, this is Dr. AJ Shah. I'm sitting down with Mrs. Ray, Rosalie Ray, right? How long have I been seeing you now? How many years?
I really honestly don't know.
I think about 6 or 7 years. And you've done very well. You've done extremely well. And today we are talking about your blood pressure, which is good, your cholesterol, which is very good, and you take care of yourself. That's very important. And you also have had some irregular heartbeats, and you've done very well. But today I'm going to talk to you a very important issue, which is drug interactions. You know what it means?
Yes, I do.
What it means is that, tell me what it means.
All right, it means that if you're taking two drugs that aren't friendly, they can make you ill.
Which medical school did you go to?
A
Life.
lot of years.
Life. I call it a life medical school.
That's it.
Most patients know more about their body than their doctors, you know that?
I know that too.
Because life is the best medical school. People don't realize, doctors don't realize, government doesn't realize that the life is the best medical school. Just living normal life is the best medical school. So you've gone through that and you just answer better than any doctor can answer. So let's go through the medications you're on, right?
Okay.
So for example here, you are on medicine called simvastatin.
Okay.
Simvastatin, you use it for what reason? Cholesterol. And you are taking 40 milligram.
Yes.
When do you take it?
Evening.
Evening, because it works in the
Before
evening.
bed.
Before
Before
bedtime. Now you are on verapamil,
Yes. High blood pressure.
high blood pressure. If you look at the information we have, if you are on simvastatin and verapamil together, the level of simvastatin in the body can double and triple.
Okay.
And when it doubles and triples, simvastatin, like any other statin, can affect the muscle and the liver.
Right.
Now, it hasn't happened in your case yet, but my job is to have it happen never.
Okay.
So, simvastatin and verapamil, what do you call it? A drug?
Well.
Drug
yes,
interaction.
Drug interaction. Yes.
They're not friends. Like you
Okay.
said, they're not friendly to each other. So you already got two. Now let's go to the next medicine. You are on medicine called Ridmol.
Yes.
Why do you take a Ridmol?
Heart medicine too.
For fibrillation.
For fibrillation.
Did you know simvastatin and Ridmol are not friendly also?
No, I didn't.
Now, simvastatin is a great medicine, and we use it more and more. I don't use it at all, period. But doctors use it more and more because it costs $4.
Oh yes, the drug cost is usually a big thing.
Drug cost is a big thing. But we want to use a drug where cost is important, but friendliness to each other drug is important also. So if we find a drug which is same cost, same effects, but it's friend with all the drugs you're on, you think you should be doing that?
Would probably help, that's for sure.
You think it probably will help or it will help?
Okay, let's put it this way. If it makes it better, it will help.
Yes, because we are giving you same medicine, a cousin of simvastatin, so they're cousins, so it's going to do same job, but it will be friend with verapamil and Ridmol.
Okay.
So you think it probably will help or it will help?
Well, you're the doctor, you're saying it will help.
It will help. I mean, to me, what I'm saying is based on science. Now, I cannot say what's going to happen tomorrow, day after, but I'm thinking what I know and what book tells me and what I've seen it for the last 25 years.
Is that a combined drug then? I mean, is it a two-part drug?
No.
It's
The
just
one
drug?
we replace for simvastatin, commonly I replace it with medicine called pravastatin.
Okay,
I still see doctors using simvastatin, the one you were on.
yes.
But we have a better medicine at the same cost available. Why if we just can put everybody on a better medicine if it's the same cost? Why?
I don't know, I really don't. Unless
Because-
they're not educated in it.
Which medical school did you go to?
No, don't do that.
Now the reason I say that, because simvastatin went generic first. So simvastatin went generic 5 years, 6 years ago. And that time it was fair to spend $4 instead of pravastatin because it was $70. So it made fair sense to use $4 drug.
Yes.
Still not the best sense, but fair sense. But since then, after a year of happening, pravastatin has gone generic now.
Okay.
So
I
we have
understand that.
so we have no excuse as a doctor not to change simvastatin to pravastatin.
Okay.
That's how I feel.
All right.
And you will never find any of my patients on simvastatin anymore since the pravastatin has gone generic.
Well, I think too that even if you write a drug name on a script
Yes.
and it goes to a drug house,
Yes.
you will get a generic first.
Pravastatin is generic.
No, but I'm saying
I
you
know
will
what you
get
mean.
a generic first,
Yeah.
even if you're asking
Yeah.
for the name
And-
drug.
and-
They make decisions there. They call the doctor, but they make decisions there because I've had some problems with them. My husband's a diabetic, but he's also got bad eyesight. Change the size of the needle to a bigger one, and he can't read the lines.
Oh boy.
So there's a limit on how much
How
insulin
much
he
he
can
can
take
take.
in a certain size needle. They make the decision.
And that's pretty dangerous because if he takes wrong insulin, his sugar can go down or
That's
up
right.
and he can die.
But we've talked to our family doctor, and he makes a fill as written.
And now it works.
And now,
But it's an extra hassle for you and the doctor to go through.
on the smaller cc's, there is definite lines, you know. On the bigger ones, they fracture because they're a lot of little lines.
Little lines. Those are all such a good points you made. And I think to sum it up, I think we have to be careful about drug interactions. We definitely have to talk about simvastatin. We definitely talk about drug house and those effects. All right, thank you.